Okay. So Tracy, so I know you're very keen on tech and innovation in the industry. So talk me through that a little bit, your feelings about that.
Yeah, I mean, I changed a lot. I mean, I ran my practice for years, just me, one other person with me, professional, and you know, my hand and needle were what I built the practice on. And that's the first thing I'd like to say about building practice, that's a sound model. That's a sound model. Injectables, and you don't need lots and lots and lots of tech to have a successful practice. So my practice is still driven by the injectable part. However, over the years I have become more engaged with technology, and that's largely because everything has moved so much further on. So, and also because I own a non-surgical practice or have owned a non-surgical practice, so we had to look, we would refer to surgeons like yourself, Adrian, but we would be looking to try and provide the whole service for people who didn't want surgery. So anyway, over the years I did start to embrace more the idea of technology, but really being convinced of what that did. I was one of the earlier adopters of Thermage, and Thermage in those days, you know, to skin tighten was okay. I mean, for some people it worked well and some not quite so well, but it was actually pretty good. But now I suppose for me, my go-to treatments for technology and what we're probably most known for, and with the industry more evolving into more body contouring and body awareness, you know, body is the new face and all of that, is CoolSculpting. So cryolipolysis and CoolSculpting. And I have found that technology remarkable for the way the business growth has been, but also for what it can provide to patients. It really does work. And it doesn't cannibalise liposuction or Vaser, or actually it complements and offers something different. So I will often refer to surgical colleagues, but actually CoolSculpting will provide a very, very effective non-surgical body contouring solution for either those people who are not suitable for surgery or don't want surgery, or actually have very straightforward areas to treat.
So talk me through CoolSculpting for people that may not know about it.
I mean, it's interesting. It's very clever, and it almost sounds too good to be true. And things that often sound too good to be true often are too. But actually, this is very clever. It's working on the theory that you and I both know, that if you actually take a fat cell and expose it to extremes of temperature, either heat or cold, it will die.
It will burst.
It will burst and die. So with heat, I don't want to get too technical, but with heat, the fat cell will necrose and die. With freezing, the cell undergoes natural cell death called apoptosis. So it sort of crystallizes. The body recognizes that as foreign material, breaks it down and excretes it naturally.
Just one thing I'd like to say is we don't get more fat cells as we get older.
No.
The fat cells that we've got just get bigger. So we put weight on.
Yes.
They get bigger.
So that's what's very important to get across, which is, again, from a surgical point of view, but also it's actually that we're asked that a lot. So the point is that this treatment is it eliminates the fat cells. They do not come back. So everywhere that CoolSculpting is done, the fat cells won't come back. That is a long-term solution. Of course, what you're referring to there, Adrian, it doesn't mean fat goes elsewhere on the body, but if somebody gains weight again, the fat cells that exist in our bodies, our fat cells like a balloon, isn't it? It will swell and shrink. So if someone gains weight, then they may not gain weight so much on the areas we've treated, but they will gain elsewhere. But any kind of fat loss solution, such as surgery or non-surgery, does not make weight or fat cells form anywhere else. No. That's not true.
But if you put weight on,
the existing ones will swell.
The existing ones as well.
It's the same in it.
Okay, so who is suitable for CoolSculpting?
Well, I'm going to say almost everybody, but I will cover myself when I say that. You can use the ideal candidate is normal size, not thin, not obese. Normal size, who has got areas that are resistant to diet and exercise. So the classic areas are, the tummies, and again, in younger women it can tend to be more abdomen and thighs. With older women it'd be lower abs and upper abs, because
Yes.
we tend to put on weight between the breasts and the navel. Middle-aged women
Right.
get the double tummy.
Yes.
So abdomen, back fat,
Yes.
flanks, bra fat,
Yes.
arms are
A big area.
a
of it.
very good area for treatment because
Yep.
the skin actually tightens as well. So arms, inner thighs, as I said, outer thighs. It's very, very versatile, but one of the biggest areas we use it on is double chin.
Yes.
So we use it in combination with our facial work a lot. Because
Yes.
double chins, as you know,
Yes.
and submental fat can be genetic. Well, it's genetic
some-
in young people.
absolutely.
But it will get worse often as we get older, and that can really bother men and women. It's popular as a treatment with both men and women.
Yes. Okay. So let's say. So tell me your average person. You know, if you could say an average person having liposuction, coming. How many CoolSculpt, how many treatments would they need?
Yeah.
How does that work?
So an average person would probably need. We assess them, and the way the treatment works, it's slightly difficult to say this without showing you the applicators, is we can work out a whole treatment plan then and there. So the applicators are placed to overlap. So we can treat multiple areas in one session, to answer your question.
Yes.
So we could treat abdomen and flank in one, we
Yes.
could treat, we have multiple machines we put on. So you can treat arms at the same time as abdomen.
Yes.
So, because that's why we have multiple machines. So in an average size person,
Yes.
with whatever their treatment plan is and multiple, we could do one treatment, one visit, one session, review them at 8 to 12 weeks,
Yes.
normally 8 weeks first
Yes.
of all, because by then most of what's going to happen some things will improve longer.
Yes.
And then there may be some areas we just want to go over
Tweak
again,
a
which
little
have
bit.
areas that have more spot
Okay.
fat than others.
So is it painful?
It feels pinchy. When the applicator first goes
Yes.
on, it does feel like pinchy, and it feels cold
Yes.
for about 4 minutes. And after then, you barely feel anything. When people watch television, we have television screens, they've got headphones on, watch screens, they can work on computers, they can even, if they're not having this area treated, they can even make calls. A lot of people do business calls.
Oh, really?
They're fine.
Yeah.
When the applicator comes off, it's uncomfortable for about 4 minutes again.
4 minutes.
So we have to massage it. So the technician or the clinician will massage the areas that have been treated, and that actually improves outcome. They've done clinical
Yes.
trial in half bodies.
Yes.
That actually we help break up the crystallized fat cells so that they're easier to eliminate. So the body, so you actually break down the tissue.
And how long's the treatment going to last? How long physically do I need to be
in the room.
Having the...
Very quickly. So if you've got multiple machines, which we have, each treatment area takes 35 minutes.
Right.
So depending on how many areas you're having done, but we can do 2 areas in 35 minutes.
Yes.
So maybe, let's say, if somebody's having abdomen and arms done, maybe a couple of hours.
Yes.
But again, they can use that time wisely. It's not wasted time. They can...
And then afterwards, what would I notice afterwards? What's the time frame?
Yeah, immediately afterwards the area's a little bit swollen, a little bit red, but it's fine. Occasionally people might have a little mark or a little bruise, but that's rare. A little bit numb for a couple of days, maybe.
Yes.
A little bit tender for a
Yes.
couple of days, maybe. If
Yes.
we've done a bigger tummy, then it'll be a bit more tender. So it might be tiny bit swollen for a few days, and I'm talking about the average person.
Yes.
It varies. And then you normally see some result coming through as early as about 4 to 6 weeks. You start to think
4 to 6 weeks?
4 to 6 weeks. You definitely start to see it by then.
Yes.
And you start to see that as the fat is eliminating from the body, you think, actually that's looking a bit better. At 8 weeks, you should see a significant improvement.
Yes.
Again, I will cover myself by saying people vary.
Yes.
And depending on their size and what we've done and the shape of the applicators, and we'll manage that.
Yes.
That expectation management is important.
Yes.
We might make people then wait again for another 4 weeks to review them at 12 weeks.
Yes.
But normally, if we're going to embark on a second session of treatment,
Yes.
which we would have already head start to that patient before they started on
they
anything, we will normally do that between 8 to 12 weeks.
Yes.
But it's realistic to expect to see a good result at 8 weeks in the majority of cases.
Yeah. Brilliant. And so let's say I had diet-resistant fat,
Yeah.
in
Yeah.
these sort of areas
Yeah.
and chest areas. How much would it reduce them?
Yeah. I can only say, because that's all I'm at,
Yes.
up to 27%. that's in the applicator.
So 27% of the fat would go.
Correct. Correct.
Yeah.
Now, if you actually, and I use a sort of visual with people, I say, if you think of this as the arm here, the width of an arm, right?
Yes.
Because a lot of people say, well, that's not very much. But actually, if you took away, that was your arm that you had out here, and you took away sort of 27%,
that's quite a lot.
It's quite a lot.
Yes.
And actually, in some patients, or if we're overlapping applicators, we get a double hit.
Yes.
So it will then be more than that.
Yes.
So actually, our artistry, creativeness, if you actually overlap the applicators where the maximal bulges are, you can get considerably more than that. So we would do that even on arms where there's a maximal bulge, we'd overlap.
Yes.
So it's very clever, and that's why we have to assess really carefully what we're getting.
Yes.
It's important to say, and we always declare this, some people are slower responders to, some people are, we know this because having used tech for many, many years of all sorts, this treatment, CoolSculpting, is FDA cleared. It's proven to work.
Yes.
There's nothing hocus pocus about it. It works. It's safe. But there's a natural distribution of how people respond to it.
Like everything in life.
So some people respond amazingly, and they're one session it's like wow. The majority of people respond very, very well, and they're very happy with it, and they may go on to have other areas done. And then there are slower responders that you either need to do more treatments on top of, or occasionally you'll get a non-responder. And that is for us to discuss with our patients when they see us.
And you know what I'm going to ask you now, Tracy?
Have I had it?
No. I was going to ask you your top tips.
I could tell you if I've
had it. Your top tips if you're considering CoolSculpting.
Okay, if you're considering any kind of non-surgical fat freezing, my advice would be make sure it's FDA cleared, and CoolSculpting is FDA cleared. So that's the first thing. I'm not banging the drum for one technology, but it's a safe technology. So make sure the treatment's safe. CoolSculpting is safe. Go to somewhere that have done a lot of treatment. We've done over 15,000 treatments now, coming up to 16,000. I think it's very important. As a clinic, you learn so much stuff along the way. You learn how to do things well. So look for experienced clinics. Ask to see before and afters, not just from a brochure, but from that clinic. And if you want to actually speak to people who've had it done from that clinic, ask to speak to people. We have patients who say, "Oh, we'll speak." So, and that's the same again with anything, isn't it, that we do. And make sure that you have a doctor-led clinic. It should, though the best people often to execute these treatments are not necessarily doctors, because actually the people who are very artistic often are the estheticians or the nurses that do it. Make sure it's doctor-led, because it is a medical treatment.
Brilliant. Well, thank you very much, Tracy.
Thank you, Adrian.